right, so welcome everyone. I'm Dr. Wakim. I'm on the Committee for Conventions and CE with the Florida Dental Association, and we are with Debra Nash this morning, Debra Englehardt-Nash, and she is from Charlotte, North Carolina, and she will be one of our speakers at the 2024 convention that we will be having at the Gaylord Palms here in beautiful Orlando, Florida. So welcome, Debra. How are you this
Good
morning?
morning. Welcome. Look, I'm looking forward to it. It's going to be a
Well,
great meeting. You've got a great lineup.
we have an amazing lineup, and we're excited to showcase you and your expertise at our convention. What I really wanted to do this morning was just kind of have a bit of a conversation with you about your course, your institute, and what you can offer our member dentists and guests that will be attending the Florida Dental Convention.
Oh, well, thank you. I'm actually doing 2 courses for you. I'm excited about it. So my two of my favorite courses, communication skills for the dental team, and that means the entire dental team. I'll give you kind of some quick tips about some of the conversations that we're going to be having. And I'm also talking about the 5 secrets of success for the dental practice. So those are 2 sessions that I'll be conducting. And I will say that communication skills for the dental team is one of my very favorite topics. And actually, here's why, because if you think about it, and I know you're a practitioner, and I'm sure you'll relate that 85% of the time that you spend with your patients is in communication, and 15% is clinical application. But when you went to dental school, how many classes did you take in how to talk to patients? So I always say, yeah, it's one thing to know how to do it clinically. It's another thing. It's another set of, that's one skill. That's a skill. It's another set of skills to know how to talk to the patients so that they understand the treatment, accept it, and choose to pay for it. So that's what we're going to be talking about, is how you move the patient from, pursuing your dental treatment to saying yes. And it starts, man, we're not going to spend a lot of time talking about social media, but it starts with their attraction to your practice. And I always say that the minute the patient called your office, they chose your practice. They chose you. Now our responsibility every step of the way is to validate they made the right decision to seek your care. So
Sure.
that's what we're going to be talking about.
And with social media these days, you're absolutely right. They already have an idea of what your practice is like based.
Absolutely.
That's if you have social media.
Yeah. Well, social media, I think in today's world, any strength taken to excess becomes a weakness. Social media is a blessing and a curse for almost every industry, because so have you ever had a patient call your office and say, hey, I was online and I learned, actually funny story. A lot of people know that I'm Debra Englehardt-Nash because I married a Southern bald dentist, and and you would relate. I see you would relate. And if you would have ever told me I was going to live east of the Mississippi, not in a million years. But um, speaking of social media, so one day a patient came in to the practice and said to my husband, hey, he's an architect, and actually he's rebuilding. He's responsible for the mess at Charlotte Douglas Airport right now, because it's his firm who's redoing the remodel. And he came in, he said, hey, Ross, I was online last night and I was looking up dentistry, and I was looking about bridges and crowns and bridges, and I have a couple ideas about how we're going to, what kind of bridge, what kind of crown I should put in. Once again, social media. So fortunately, my husband's pretty quick on the uptake, and he said, Carl, that's really interesting, because last night I went online about how to build an airport, and I have some ideas. and,
That's pretty good.
and the patient said, okay, I get it. I get it. But once again, social media, people will say what? Google reviews are huge. I have a client in Tampa, Florida, and he actually pays his team a bonus to inspire patients to write Google reviews. That's not my idea. So don't hold me to
Sure.
that. But that's how important they are. They say that.
Absolutely.
Yeah, it's huge. It's huge.
Absolutely.
Yeah.
Absolutely. So
But here's what's interesting.
yeah,
Dr. Wakim, they're not going to go on Google and talk about the tertiary anatomy of your crown.
of course not.
They're going to talk about how they felt while in your care. So my courses are all about how do you engage and enroll the patient so they say, wow, not only did I have a great clinical experience, but I had a great emotional experience in this office, and that's what I'm going to tell my friends. That's why my friends are going to be referred to you.
Fantastic. So, I've been in private practice myself since 1990. When we moved to Florida about 7 years ago, because I had my business deal fell through, I was without an office, so I kind of went into the DSO world for a couple of years to finally discover where I wanted to build and open my own private practice here in Central Florida. And what I noticed is that in the DSO world, they have courses just like this where they teach not just the doctor, but the entire team about communications. And they actually call it the communications course. And it's an intensive day and a half course for all of the participants. And so I'm just kind of curious, uh, as a private practicing dentist, what can we get from your course, and what can we expect if we bring our team members as well?
Ah, okay. Well, that's interesting. I know that, we have you talked about the Nash Institute, which we have a postgraduate training center in outside of Charlotte, North Carolina, and I do a component. I mean, it's the majority of the training is clinical, but I always do a practice management component, and I always do communication skills and what questions to ask patients and how you engage patients. I'll give you a couple of suggestions of examples of that. And the dentists always come up and say, I would love my team just to spend a day with you on how to talk to patients. I had a client on the other yesterday on a Zoom call, and he said, man, you just are a master at how you communicate, how you talk, what answers you have for patients' questions, patients' objections, how you enroll them and engage them in the office. And I said, he said, you just have a gift. And I said, no, I don't have a gift. I've trained myself. I've educated. So it's like dentistry. I mean, the more I do it, the more comfortable I become. And so I think how great that DSO has a training program, and I know a lot of practices do. So my my two courses are really going to be about training from the moment the patient calls. And here's a kind of a little teaser. I think the most important question when a patient calls an office, it's not about what insurance do you have. We get all caught up in if I say, my name is Debra Nash, I'd like to make an appointment for a new patient exam. And the first question is, well, what insurance do you have? Now we have a 10-minute conversation about deductibles and exclusions and exceptions. And that is not the right question. So for me, we start with, what is the right question? And the right question is, tell me what inspired you to call. Because I called you for a reason. I
Right.
called you to I wanted to make a difference in my dental life, whether it be cosmetic, aesthetic, or health, or discomfort. I called for a reason. We need to find out what that reason is. And then from what happens is our conversation spins from that reason. So then we can say, oh, I'm glad you called us. This, based on what you're looking for, based on what your needs are, I can see why we would be the right office for your care. I think so that's from phone call, and we go into the, how do we talk about, I even go into talking about patients' objections or telephone shoppers. How much do you charge for? What do you say to the patient who calls? Do you say, I'm sorry, don't quote fees over the phone? No, because I'm going to lose the patient. So we talk about how do we answer that? How do we talk to the patients about our fees? That, wow, you're really expensive. And I always say, I'd be happy to discuss our fees with you. I'm happy to tell you about our fees. And I'm happy to tell you about how much do you charge for it. So I'm happy to tell you how we handle insurance. So we're going to talk about that. And then the other kind of teaser question that going from new patient to sitting down at the chair, what does the dental assistant say? I mean, once again, I say this is for the entire team. We always have I don't say always, but a lot of offices have what they call a patient ambassador, a new patient coordinator. Everybody's responsible for creating an exceptional customer service experience. So I cover, and including the doctor, but I cover from the receptionist or the telephone coordinator, new patient coordinator, dental assistant, and also the hygienist and the doctor. So we are a consistent, congruent team. The most important question, and we'll talk about that in one of the questions that I'll talk about in my communication course. One of the most important questions that a hygienist would ask a patient, and I always ask this in the audience. I like to really engage my audiences. I say, hey, bring me the difficult situations. Bring me the things that happen in your practice and say, what would you say to the patient who fill in the blank. And I'd say, let's walk through this. Let's walk through this system. I'm not a big fan of learning a script, because if the patient goes off script, now what do? You're in the weeds. So let's learn how we respond. Let's learn the system how to respond so we can respond to anything, not just to the scripted piece. Most important question that a hygienist would ask a patient of record who has an outstanding treatment plan. And and I would say, man, so many times and we're going to talk about practice management. We're going to talk about, we're going to talk about statistics. So many times we go for getting more new patients, and we're looking for the perfect patient to come into the practice, and the perfect patient who wants beautiful cosmetic and aesthetic dentistry, has no insurance, and has a lot of cash. Yeah, wouldn't that be great? But we don't always have patients like that. My husband doesn't have patients like that in his practice. We have some. So here we have a patient in the practice, and we're going to talk about that. Familiarity can sometimes breed apathy. They have an outstanding treatment plan. Maybe we have diagnosed that years ago, and we've had a tendency with patients of record to say, Sam, you need those 2 crowns. He's going to talk about that. He's mentioned that before. He'll probably mention it again. And you say, yeah, I know. And I sort of say, okay, I got 45 minutes now. I got to clean your teeth. I got to do an intraoral camera, photographs. I've got to do oral cancer screening exam. I got to scan you. I don't have time to go into that. So doctor may talk about that, or what the other thing that's happened that's even worse. In the morning huddle, I say, oh, I know Sam. He's not interested. He doesn't care. His insurance isn't going to cover it. If his insurance is going to cover it, he's not going to pay for it. He's not going to want to talk about those crowns again. And we don't. So then how important does it become to the patient? So the most important question, and these are the types of things we're going to talk about. The most important question that a hygienist would ask a patient is this: Sam, I see the doctor has recommended treatment that several years ago on the upper right side, and we have yet to complete that for you. Tell me what has prevented you from having that done.
They'll probably answer, doesn't bother me.
They're going to say, it doesn't
Right.
bother me. And we're going to say, oh, so you're going to wait till you're in pain to have that. Or they're going to say cost. Cost is, but what sometimes happens, the minute the patient has an objection, we say, oh, okay, yeah, I see. So we have to train. How do we answer those questions? If it doesn't bother me, what are we going to say? It's cost. So what do we say if the patient said, it's expensive? And I might say, well, Sam, think about this. If we had done it 4 years ago, what would it have cost you then? What will it cost you 4 years from now? So if cost is the factor, it's never going to cost you less than right now. What other
Exactly.
concern? If we could find a way to make that affordable for you, what other concerns do you have? Doesn't bother me. So those are the things we're going to be talking about in the, how do you take the time and how do you train your team to answer those questions so they don't feel awkward and clumsy? Because if I feel awkward and clumsy addressing those concerns with the patients, I won't.
And you hit a particularly good point, and that is a lot of patients, they hear from us as the provider, as the dentist, that they need this work, but having the team kind of reaffirm that, I think, is extremely helpful psychologically to the patient when they hear the hygienist reaffirm it, and possibly even the dental assistants reaffirming it. Hey, Sam, you know what? I see Doc treatment plan this tooth a couple of years ago. I don't think you need to wait. I think it's time for you to get this done. And if you wait much longer and you start to have pain, it's going to be a much more expensive problem. So having your team reaffirm what you as the provider if you've already told the patient that this is necessary, the team reaffirming it makes a huge difference. Absolutely.
I think one of the things I will be talking about in actually probably a little bit of a spillover into the 5 secrets of success as well is I'm a big fan of teaching the team how to endorse the doctor. I am sure that you don't walk into an operatory and say, darn, I'm good. You're so lucky to be with my hands. But it's responsibility of the team. I always say that my responsibility as a team member is to create the perception of quality remote from your presence. You're not going to walk in and say, hey, I'm great. But as a dental assistant, hygienist, treatment coordinator, I should have a story about, can I tell you why I work here and why you're in good hands and the respect that I have for the person with whom I work. So those are, what are the things that is the dental team saying about the patient? Because you're right. So many times a doctor will walk out of the room, or gosh, we could do the whole course right this morning because I've had like a cup of coffee. The doctor will either be in a room by him or herself, which I would not recommend. We'll talk about why in my courses. And or the doctor is not there, and I'll tell you, the patient turns to the dental team and say, what do you they always, many times they ask, what do you think?
Right.
You think I
Yeah,
should do
we hear
this?
that.
Oh, yeah, do you think I should do this? And if a dental team member doesn't know how to answer that, if they say, well, I don't know. And I mean, I go into a lot of, sometimes I still consult, and sometimes I go into offices and the team says, I don't have my work done here. It's like, what? What? Uh, That's unheard of. So how can you endorse the doctor? So I talk about doctor endorsement a lot in both of my classes.
That's great. I'm a firm believer in actually endorsing the entire team in
Yeah,
my office. So we
yeah,
always, I always let my patients know that they're in good hands with my assistants. They're in great hands with my hygienist. I think that cross endorsement, I think, is a great system to have in the
absolutely.
office. So, dentistry is changing, and of course, you've been in this profession for quite some time. I
Forever,
was looking,
forever.
I think you and I, we're both California kids,
We
right?
are
But living on the East Coast, and I'm from the Bay Area. You're from Southern
Orange
California.
County. I know, I
And,
know you Northern
when
California people.
right, so when when we started back in the 80s and 90s, dentistry was a completely different ball of wax.
No DSOs.
No, well, in California there were a
Few,
few. There was Western
few.
Dental and a couple of
Yeah,
others, but certainly the DSO world has just expanded tremendously. I actually think there's going to be consolidation in the industry going forward. But what I want to find out from you, from your perspective, because you're actually talking to doctors from all across the country. You're seeing offices in probably all 50 states. What do you see right now is the most pressing issue that we face in the private practice dental office today, and what advice would you give to overcome some of those issues?
oh, I think you already know what mine is going to be. It's team, it's staffing,
Exactly.
it's staffing. And I think, interestingly enough, and you were right, because yeah, here's an interesting factor when we talk about DSOs and we talk about dental insurance, and we talk about the East Coast versus West Coast. Dental insurance started in Oregon, Washington, and California. It was those three unions in those three states created dental insurance as part of their medical plan for the union workers in 1957. And in 1957, dental insurance, the allowance per year was $1,000 in 1957. Interesting.
Right, here we are 70
But
years later, and it's about the
yeah,
same for some folks.
yeah. So in 1957, insurance covered a lot of, $1,000 a year covered a lot. An average crown, I think, was $147. So, but staffing is huge. Staffing is huge across the country. It's on the hearts and minds of dental teams. It's on the hearts and, I mean, of team members. It's on the hearts and minds of consultants and speakers. How do we attract and retrain good employees? I think one of the things that, once again, that maybe that that the DSOs have an edge on private practice dentistry is the corporate benefit structure that they can provide. They can provide. So you have to ask yourself, all right, so if a big corporate dental environment can provide this benefit structure, and this corporate kind of corporate features for a team member, what can my private practice provide that would be different, that would attract quality employees? So I think you have to pull out and say, what do we have that would be different, but as could be appealing for somebody? And I think we need to hold those out in terms of what we have to offer. I think the other thing that sometimes happens, and staffing's expensive. And I think sometimes I always say, doctors, don't step over $1 to pick up a dime. You got a great employee, and he or she, they are looking for, maybe $3 more an hour, and you are, you're fighting it. You might want to take a look at Why are you fighting it? Are they not a viable, if they're not a viable employee, I understand. But if you really want to keep them, that $3 is a great investment. The other thing that I would say that I know a lot of offices or a lot of practices offer sign-on bonuses. That's been a conversation, and I'm a big fan of retention bonuses. Reward your team who stays, and talk about that. So I think creating, I think we all agree as consultants and speakers that when we're looking for the right team members, when you're putting any kind of posting in, whether it be Indeed or dentalpost.net or whatever classified advertisement you're posting, it's not about your how many days a week and hourly. I really think you need to feature your culture. What do you have to, what kind of environment am I going to be working in? With who am I going to be working in? And here's one of the things that's important. We used to say, in a family environment, people in today's world, employees don't want to hear that they're going to be in a family environment, because that implication is you're expecting me to be available 24/7. So we have to find different words that we're using for the age group. What am I looking for? I'm looking for innovation. I'm looking for autonomy. I'm looking for being a part of a great picture. I'm looking for being rewarded for my efforts. So I think those are the things, as opposed to, family-oriented dental practice. A lot of offices now, there's got to be a balance,
Sure.
and I have my own family. I want to come to work. I want to be appreciated for what I do. I want to be important. I don't want drama. I want to link to you to be able to have a conversation with you, and I want to be able to go home to my family. So I think one of the things that when we talk about attracting is we understand and appreciate the quality of life and the balance of life, and we create in the environment to be able to provide that for you.
So if somebody comes to this course and drama in a dental office, say it ain't so. So what, and I know listen, you and I, we could talk for hours on this
You could.
topic. And
They
but
could
what
get
I want,
continuing education credits for this time right now.
right? I've already picked up a couple of pearls from you, so thank you. So to the person who's watching this video and they're thinking about coming to the convention, I think they've already may have heard a couple of takeaways from you, but what do you think are maybe one or two big takeaways that they're going to take from your courses when they come down to the Gaylord Palms in June?
Couple things. First of all, I mean, I will have to back up. I wrote an article for the Florida Journal. Interestingly enough, I probably already had about a dozen people say, and actually a friend of mine said, I was reading this great article in the Florida Dental Journal, and then I saw who the author was. It was you. So I thought that was kind of cool. And I'm probably going to offer this article if people didn't pick it up in your newsletter, or however that came out. So
Magazine.
I'm going to talk about the 6 killer questions to get patients to say yes. I think there's 6 really important questions that need to happen in the dental office. And I think one of it is how to present treatment. So sitting with the doctor, so many times, again, we'll elaborate on this in the courses. We're going to talk about body language. Where should you sit? Where should you stand? How are you pacing yourself when you're having a conversation? And what is the most important thing you say to the patient when you're getting ready to present the treatment plan? And there's a question you will never get a no from a patient when you ask this question.
Wow. Okay.
I'm going to talk about that. You'll never get a no, ever, 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 never. Doesn't mean the patient may move forward with treatment, but they're never going to say no to this question. And I think that's really important. So yeah, we talk about patients don't buy what they need. They buy what they want. We sometimes we present it and say, we're going to go through tooth number. We're going to go through and do a comprehensive examination. We're going to gather diagnostic information. We're going to sit down with you and tell you what you need. We're going to tell you how your insurance is going to be covered. We're going to tell you what your copayment is going to be. And we're going to give you our financial policies. We bombard them with policy. We bombard our patients with office policies. Your patients don't care what your office policies are. They care about how you're going to serve them and how you're going to treat them. So the way we introduce office protocols, the way we introduce the understanding we have with our patients about how we make things work for them, how we make things work for them, not how we make things work for us. There's a huge shift
Sure.
in how we communicate, and we're going to talk about that in my classes.
Sounds great. Listen, I'm sold. I'm going to have my entire team come listen to you in Orlando, June 20th to 22nd at the Gaylord Palms in beautiful Orlando, Florida. Bring your families as well. The Gaylord Palms is known for its water parks and the convention center. We're looking forward to hosting you, Deborah. I want to
Thank
thank you
you.
for joining me this morning,
Thank you.
and look forward to seeing you in June.
Great. I'm honored. I'm honored to be there. I'll see you in June.
Thank you, Deborah.
Uh-huh.